Good afternoon, everyone. I'm very pleased to be participating, although remotely because of COVID-19, to the 11 CIMDR event. I'm so sorry that I cannot be with you there, but I will be very happy to share with you how innovative medical technologies can contribute to better health. I'm the COCIR Secretary General and also DITA Chair. I will be covering today with you three elements after having given you an overview on what is COCIR. First, the importance of clinical data and how digital can contribute to real-world data. Second point will be focusing on COVID-19 and what our industries are doing. Third, we will go through the journey and on innovations of medical devices in order to contribute to better healthcare. So let me start with introducing COCIR. COCIR is a European Trade Association created back in 1959, and we have offices in Brussels and also offices in China since 2007. We are representing the medical industry in Europe. We are covering 4 key industry sectors and are leading the industry voice for medical imaging, radiotherapy, digital health and health ICT, and electromedical. All our industries and members are global players and provide state-of-the-art medical technologies and provide also services in order to have integrated solutions covering the complete care cycle. We have 2 types of members. We have companies, and you can see highly respected names in this. And we have also in Europe a national trade association representing another layer of industries. COCIR at international level is also very active through DITA, which is the Federation of Trade Association around the globe. And I'm very happy and proud to be the COCIR, the DITA chair until the end of this year. Let me now go into the first chapter on importance of clinical data and how digital can contribute to real-world data. The importance of clinical data in the context of CIMDR. The clinical evaluation is a methodologically sound ongoing procedure to first collect, appraise and analyze clinical data pertaining to a medical device and to analyze whether there is sufficient clinical evidence to confirm compliance with the general safety and performance requirements that can be based on the result of non-clinical testing methods alone, including performance evaluation, bench testing and preclinical evaluation. In the case of implantable medical devices in class 3, for example, clinical investigation shall be performed. Here, this is a list of available guidances on clinical evaluation and investigation under the CIMDR. All these guidances are available publicly. You have a guidance on sufficient clinical evidence for legacy devices, a guidance on equivalence. There is a clinical evaluation assessment report available, post-market clinical follow-up report, safety reporting in clinical investigations, summary of safety and clinical performance, and guidance on clinical evaluation performance, whether it is CIMDR or IVDR, of medical software. The use of real-world data is used by healthcare systems to better leverage real-world evidence to improve patient outcome and processes enabled by technology solutions. It is also used by manufacturers for the development and validation of artificial intelligence-based health and medical software. It is also being used by regulatory authorities, especially in vigilance and market surveillance activities. And last but not least, it's being used by health technology assessment bodies, payers and procurers for assessing the value of health innovation for market access. How digital can help in the real-world data? Changing the boundary of what is considered the health data. As you know, there are more and more elements that are critically important and where digital can make a big difference. First, we have electronic health records, we have genomics data, we have input from wearables, we have also more digital information on nutrition, lifestyle, socioeconomic conditions, living environment, water, soil, reported outcome. So digital health provides the opportunity to collect and combine and share data, leading to insights and innovation, improving patient outcomes. How digital can help in real-world data? In Europe, we have a lot of discussions going on, especially around the establishment of a European health data space. Recently, the European Commission announced that there would be a joint action, especially focusing on European health data space. That would include data governance framework, access and use of data, importance also of data quality with interoperability, standardization and fair principles. Third, on infrastructure, system architecture, cross-border exchange. Last but not least, capacity buildings and also skills of healthcare professionals and engineers working around the healthcare domain. Now I will be moving to the second part of my talk, that is focusing on COVID-19 and how our industries are, what are the initiatives that our industries are taking. So our industries have been dynamically involved with the reorganizations of their activities to respond to the COVID-19 demand. They had to supply priority medical devices for COVID-19 patients, so ensuring manufacturing plants can work and readjust their production to respond to the demand from various governments and hospitals. Also ensuring engineers and workers have protective equipment and can move safely across borders to ensure installation and well-functioning of equipment in hospitals and at home, and also share best practices and show the importance of digital health. Our industries are constantly innovating, especially these days with regards to providing priority medical devices. And just to name some of those priority medical devices, that includes ventilators, imaging equipment also, including CT, MR, X-ray, ultrasound, but also oxygen equipment and many other type of disposables and hardware. In addition, and because of the increasing importance of digital health, we are communicating even more on the following elements. First, on cybersecurity, ensuring cybersecurity by design. Also, artificial intelligence. We are sharing more and more concrete cases that shows how AI solutions are used in practice. We also published a health data space paper, with COCIR recommendations. And also we have been advocating and insisting on the need for implementation and scaling up of electronic health record solutions and how critical it is to ensure interoperability. We had at a global level, at IMDRF level, on the 21st of September, we as DITA were very proud to cooperate and collaborate with the IMDRF chair and management committee. So IMDRF chair being from Singapore, we agreed to organize a virtual workshop where the goals were to discuss the implementation of the IMDRF cybersecurity guidance in different jurisdictions, learn more also from healthcare providers on steps towards ensuring their facility is secure, and learn what the medical device industry is doing to make devices more secure and prevent cyber attacks. We were very proud that we had a maximum of 500 people registered in that virtual event. 322 attended, with a mixture of regulators, auditing organizations, healthcare providers, scientific societies and industries. For the speakers, we had 18 speakers from 6 jurisdictions, from regulators: Singapore, USA, Canada, EU, Germany, Belgium, Japan and South Korea. The key takeaways of this very exciting workshop was that all actors, both regulators, healthcare providers and healthcare professionals and industries in the medical device regulatory system, consider cybersecurity a priority and take active steps to ensure safety and security of devices. The guidance on CIMDR cybersecurity was published, and it was considered to be an excellent first step towards global convergence. Further work is necessary still on, example, the practical implementation of security for legacy and transitional devices, and shared responsibility at international level. Cybersecurity was recognized to be a shared responsibility across healthcare stakeholders, essentially regulators, healthcare providers and industry. From an industry standpoint, as I mentioned a little bit before, all our industries have implemented what we call the principle of cybersecurity by design. So the manufacturer is responsible to address cybersecurity during the entire product life. The expected intended operational environment of use has to be clearly documented through instructions for use and other supporting documents. Newly identified threats and remediation scenarios have also to be communicated very dynamically towards hospital providers. Sharing information must be bidirectional. That means from the manufacturers to the hospital, from the hospitals to the manufacturers, and also together with regulators. So security information through accompanying documents such as, but also not limited, as I mentioned before, instructions for use, instructions for administrators, and network administrator guides. Information is also published on the manufacturer's website or part of procurement process, including security and privacy white papers, the NDS2 documents, system security status, security notifications, and other security relevant information. Because of COVID-19, with the industry and our manufacturers in particular in the medical device area are suffering from audit that have to be performed by notified bodies. So we recently communicated through the EU institutions that there is a need for remote audit under the medical device regulation. So what we are facing is that several notified bodies will not update existing MDD certificate anymore. COVID-19 is delaying the MDR audit due to travel restrictions. So many audits were postponed until between November this year and even earlier next year. We see this happening, unfortunately. So that is and we see limited possibilities to step back to MDD production at the manufacturer's level. Thus, there is an increasing need for remote and virtual audit, to allow a remote and virtual audit, and this is the reason why we asked EU institution to expand the current guidance on remote audit to all devices under the MDR. Now, when we look into the qualification of software as a medical device through the CIMDR, authorities have been defining what software, including software that uses artificial intelligence, could be considered a medical device. Regulators call it Software as Medical Device, SAMD. This is a framework for risk categorization of SAMDs. This was created as well by CIMDR. However, internationally, large differences with respect to the scope of SAMD that a country regulates still remain. The US FDA, for example, uses the fault line provided by the CIMDR SAMD risk framework to clarify what software is not in scope in its regulation, whereas the EU uses functional exemptions instead. In the EU, SAMD with functionality that is limited to store, communicate, lossless compression or simple search is not regulated. In the US, SAMD to inform clinical management is not regulated if it is intended for the software recommendation, if it is intended for the healthcare professionals to independently review and understand the basis of the software recommendation on condition the software does not perform signal or image acquisition, processing or analysis. Consequently, the EU regulation has a larger scope than the one in the US, including significantly more clinical decision support software intended to inform clinical management. Risk classification differ as well, as different jurisdictions have mapped the CIMDR risk categories differently to their own risk classes. A software could thus be a Class 2A in the EU, requiring a notified body, while not being regulated at all in the United States. Let me now move to the third chapter of my presentation with regards to better access to innovative medical devices to contribute to better health care. First of all, we welcome the fast-track regulatory framework in China. Transparent, clear and measurable, critical for the review and approval being as an innovative medical device. And it is important for CMDA. The challenge, let's say there is a challenge for foreign industry, and we would appreciate if CMDE, maybe with other authorities like patent administrations, to give more training to foreign industry so as they better prepare for application of innovative medical devices, which contributes to more foreign innovative medical devices that could be approved and serve the benefit of Chinese citizens and patients. The importance of artificial intelligence, what is going on in China? Three things. First, on artificial intelligence medical device innovation and cooperation platform. That platform was jointly launched by 14 organizations, including CMDE under an MPA, the Chinese Academy of Information and Communications Technology under MIIT, and the International Health Exchange and Cooperation Center under the NHC. 12 work teams are performing from perspectives like technical regulation, data governance, cybersecurity, standardization research, and clinical evaluation, and much more. The second element is the Chinese measure on cybersecurity review. In April 2020, the Cyberspace Administration of China, together with 11 other authorities, has jointly issued measures for cybersecurity review product risk evaluation report. Third element is on China's data security law is under development. Industries are paying much attention to connection between this law and the cybersecurity law, definition of data and important data, control of data activities and testing, evaluation and review of data, and export control of data. Here, just wanted to share with you that CIMDR created not that long ago a new work item on artificial intelligence, where they will be focusing on definitions and terminology. There will be also at the EU level a development of horizontal EU framework for artificial intelligence. And here COCIR sees no need for novel regulatory framework on AI-based devices in healthcare because the requirements of EU MDR are appropriate. And this is the reason why you can see on the left side we published a very in-depth gap analysis showing how the artificial intelligence is covered under the MDR. Last slide before the end of my speech. I'm very happy to let you know that as COCIR we are quite active on artificial intelligence, let's say on digital health in general and on artificial intelligence in particular. We decided at the beginning of this year to publish a concrete use case of artificial intelligence, as you can see here, in chest imaging, for pneumothorax also, but also for breast density, etc. And we have published already 10 use cases showing practical implementation and use of artificial intelligence in healthcare, and we have more cases to come very soon. There is a link here. If you are interested, please visit our website. Thank you very much for your attention, Sheshe, and please take advantage of networking there, and you have my best regards and warm regards from Europe. Take care and take care of your families and your dears. Thank you.